Before we had the eligibility workflow, before we had insurance discovery on board, we did have to, in some cases, go back on the units to a patient who is receiving care and have to get additional information from that patient in order to verify insurance, where now, if we can get minimal information from that patient up front, that's all we need. And at that point, they're on to receiving the care and hopefully for us, getting them back out the door in a condition that's much better than the way they came in. So for us on our admissions department, for our business office, it's been really a bonus to be able to streamline that process for us. For us, largely it's been the implementation team, which for us was huge. We received a very comprehensive training on what the eligibility workflow does, what the insurance discovery does. We were able to bring in members of our management team, members of our leadership team to enable to see how it works before we were actually able to decide. And to get feedback from our directors was important. And once I got the feedback that this was something that the hospital felt was going to be beneficial for us, then for me, it was a no-brainer to sign the contract. And once I signed the contract, it took very little time to get it implemented, to get our users up to date, to get user access granted. And we were up and running in a matter of a week, honestly. And from the time we got started, the results were almost immediate. They genuinely were. One of the things that was really beneficial for us was that Inovalon actually sent me a letter on letterhead about a month ago. And what it did was it told us the accuracy of our searches. So when we first started, we were right around 50% in terms of accuracy in searches. And as of August 31st, we were over 60%, which for us was a huge bonus in terms of where we started. And in that letter, it actually stated that the national average was around 39%. So we were actually able to see from a quantitative perspective where we were. And for me, it was exciting to be able to share that letter with our directors, with our departments, because they're the ones who use Inovalon software. They're the ones who use the insurance discovery. So for them to be able to see that we're returning accurate searches, I think was huge for us to say that this is something that works, and this is something that we really truly believe has been a benefit to Rockford Center. I think for what we've been able to see so far, it's been simplicity. It really is. And where we're located in Delaware, we're located in a really unique space that we're about 20 minutes from Maryland. We're also about 20 minutes from Pennsylvania. We're also about 30 minutes from New Jersey. So we get patients from all 4 states. And what we previously had to do in some cases is we would have to go to Delaware Medicaid website to see if a patient had Delaware Medicaid. If we didn't know, we'd have to go to New Jersey. We'd have to go to Pennsylvania. And what insurance discovery actually allowed us to do, and what we actually thought made it so attractive for us, was it's a one-stop shop. Like, we get one platform that would search numerous states' Medicares, it would search Medicaids. And what it did for us is allowed us to spend less time in our admissions department searching for insurance if we didn't have an insurance card from a patient. And also, the ease in which it was able to add payers. When we first signed up, Maryland Medicaid wasn't one that was included. And all it took for me was to fill out a form, send it to your office in Florida. 2 weeks later, we were able to search and find results from Maryland Medicaid. So I think the 2 things that benefited us the most were, 1, the simplicity of it, and 2, the ease in which we were able to customize the program to fit our needs. The main thing for us is the types of patients that we see in behavioral health. When we have patients that come in, oftentimes our patients are in some sort of distress in behavioral health. And one thing that we do, and we've always taken great pride on, is our customer satisfaction and making that process as easy as possible. So what we want to do is get that patient in the front door through the intake process and to the units where they can start receiving care. And the shorter amount of time they spend on an intake process in terms of insurance, in terms of demographics, that makes the process to them receiving care that much faster, which is ultimately what we want. And one thing that we've been able to see from Inovalon is that we've been able to speed up that process and not have patients in an intake room for 2 hours, 3 hours waiting. We're able to get them through the intake process into the units, in some cases within an hour. And so what we're able to do now that we weren't able to do is to accelerate that process of getting our patients the care that they need and the care we want them to have.